everyone, how are you all? I hope you all are doing great. So, welcome back to the conversation with Rangoonwala. My name is Anu Sharma and I'm your host. So, today again, we have Dr. Kalia, who doesn't need any kind of introduction, but still, he is the professor and the orthodontic head of department at MA Rangoonwala Dental College and Research Center. And from last 3 decades, what all he has been doing, he's going to tell you that, as he told you earlier also, but please do that for us, Dr. Kalia.
Thank you, Anu. I'm Dr. Ajit Kalia, and I'm professor and head at the Department of Orthodontics at MA Rangoonwala College of Dental Sciences and Research Center, Pune. I've been teaching orthodontics for the last 3 decades, and we have created many precious smiles, which are here to remain stable in a person's life.
That's so nice.
So thank you, Anu, for...
So what are we going to discuss today? So we are going to discuss today that, why time matters for the smiles. So here we are going to talk about mostly the children oral health. So my first question here today is that why a child need the orthodontic treatment at an earlier stage?
So, a child tends to have dentition in the first year after their birth.
Okay.
And the permanent teeth start erupting at the age of 6 years. That's when the baby teeth or the milk teeth tend to exfoliate or give away, and the permanent counterparts tend to erupt. Okay. So why do we require orthodontic treatment at 6 years or 7 years of age? Well, it's simply because, we are dealing with growing individuals. The child is growing, the face is growing, and so is the skeletal structure. So we do not want any kind of bony deformation to get inculcated in a child's face in the near future when he turns into an adult.
तो आपका कहने का मतलब है कि अगर हम थोड़ा इग्नोर करते हैं 6-7 साल के बाद में तो वो प्रॉब्लम ज्यादा क्रिटिकल भी हो सकती है.
Yes, simply because at 6 years and 7 years the bone is very, very soft. Let's talk about this in layman's language. See, it is when a child is 7 years old, the child has bone, the child has growth which is present, and the bone has got a lot of cartilage in it. So when you have a lot of cartilage in the bone, naturally the bone can be molded. The cartilage can be molded because the bone is really soft. Let's talk about a simple example. You have a small tree or a small plant. Okay. When it is a small plant, if you tie it with the help of a thread to the wall, the plant starts going into the direction of the wall. Okay, you are able to modify the direction of the growth of that plant. But the same plant, once it becomes a tree, it's very difficult to change the direction.
Correct, absolutely.
Similarly, as far as our jaw structures are concerned, you have to address the orthodontic treatment at the age of 6 or 7 because the bone is very, very soft and the required amount of molding can be carried out at this particular age.
So the crux what we got from this answer is that before the milk, like when you give up the milk teeth being gone, after that
the permanent teeth starts erupting.
Yeah.
And when you are in this transitional phase, it is very important to visit a doctor in order to figure out whether the growth is proper or not, or it is in the right direction or not, rather.
Okay.
So that is the reason treating a child early is important. And in orthodontics, there is a saying which says that catch them young.
Yes.
If you want to give them the best, catch them young.
Yeah.
So for this, it is important to have a consultation with an orthodontist at an early age, so that you can carry out the required amount of correction.
Okay, so basically you have answered me the second question also, because my second question was that at what age they should a child should visit, or a parent should visit along with the child to a orthodontist. Basically we have already answered. 6 plus.
So 6 plus is 6 to 7 is something which is an adequate age.
Okay.
Wherein the parent should at least have one consultation. You may not carry out any treatment. You may not do any treatment because your child is still young. But yes, we can pick up the deformities You can pick up
very
facial
easily.
asymmetries if there are any present in the child, and you can take required amount of steps to rectify them at this particular age.
As we do the myth busting also sometime, doc, so this is a very mm, uh, unusual question which comes into my mind. And मैं आपसे पूछना चाहती हूँ, आजकल जो ये लोग बोलते हैं कि you know you paste the baking soda to whiten your teeth, और नमक और सरसों का तेल, और what do you think about all these that बहुत सारे influencers and
So people come up with all these gharelu nuska, I would say.
exactly, I
but
want to know
but
that.
but there is no science behind this. So what I would suggest is, if at all you want to have teeth whitening, go visit a doctor,
A
and
certified
he or
doctor.
she, yeah, certified doctor, he or she will be able to do it. What is happening when you are rubbing salt on your teeth? You are basically creating some amount of, you are using an abrasive to rub your teeth. It's like a sandpaper, it's like an abrasive. So when you rub anything against your teeth are but natural going to be white for a short period of time. But what have you done? You have actually removed some amount of enamel from your teeth.
और
You
ये
have,
बेकिंग सोडा वाला जो
even baking
myth है,
soda is also pretty much the same. If you hold that baking soda or normal NaCl or common salt, they all have small granules, and they're asking you to rub those granules against the enamel, which is actually not required, which will create more damage than helping you out with the help of in whitening your teeth.
और सर एक चीज और भी है कि लोग अपनी ओरल हेल्थ को बहुत ज्यादा दो these are not technical question, but still we have the public out there, I mean, not basically who's looking to be a dentist or a orthodontic, but I'm talking on the behalf of normal human beings. Like so many times we ignore the cavities, we sometimes the tooth is fallen, they they do a lot of nuskas for toothache, they don't. So what do you think that the oral health, does it affect the whole body, I mean the other system of the body? Like if you have a poor oral health, you have a lot of cavities, infections in your mouth, what are the problems that you are inviting? मतलब
Okay.
basically क्या कर, is it good कि आप पेन के साथ बहुत सालों तक रहते हो? और
Okay. So there is a saying in dentistry, and according to that saying, oral cavity or your mouth is the entrance to overall health.
absolutely.
Okay. So if you do not visit your dentist once in 6 months, if you neglect cavities, if you neglect tooth pain, if you neglect gum bleeding, it is somewhere affecting your overall health. You are not able to chew your food properly. If you have gum bleeding, they say that there are plenty of articles which claim that if you have gum bleeding, then it is a sign of any kind of a heart disease. Okay. So neglecting oral health is something which is not advisable, because in the long term it is going to hamper your overall health. When you are not chewing your food, there is not proper amount of digestion which is happening. Okay, the food is not getting broken into small pieces, it is not getting metabolized, and you tend to put on weight. And when you put on weight, then the story starts with high blood pressure, high cholesterol, and any kind of a heart disease. So it is important that you pay attention to your oral health. Like in the West, in Europe or any other country, they have a annual package wherein you have to go and visit a dentist by default and figure out whether your oral cavity is proper or not, whether you have any kind of oral diseases which are present. You cannot just neglect it. We normally recommend that you should visit a dentist once in 6 months, so there are no untowards incidents as far as your teeth are concerned.
Coming back to your specialty, sir, that is it right way to say that if you go, like as a child, if you have some issue with the growth, or symmetry, or any problem which is related to orthodontics, uh, if we say that if you go for early intervention, you can save a lot of time and hassles like surgeries or something. Is it so? Like, would it be correct if we put it this way?
So, orthodontics is a branch which is not only dealing with alignment of teeth, but it is also dealing with facial deformity. Okay. You may have a chin which is way behind. You may have a chin which is way ahead of normal. So, or you may have a chin which is deviated or a face which is deviated either to the left side or to the right side. So, all these facial deformities which are present or which tend to showcase in a person's mouth are easily correctable at the age of 7 to 8 when the child is growing. If you rectify these skeletal deformities, they do not tend to get aggravated. Okay, as I told you well in the beginning that a child's face has got a lot of cartilage in it, and it can be molded into the required shape. You may have a single tooth which is blocking the growth of the lower jaw, or which is blocking the growth of the upper jaw. If the tooth is corrected, your growth will become pretty normal. But people tend to neglect this.
Absolutely.
They tend to avoid this, and then later on they come back to us at the age of probably 17 or 18, by the time the growth is already finished or is on the decline. At that particular stage, surgery remains the only option to rectify such kind of
which we could have very well
Yes.
avoided.
Yes. So we could have very well avoided had we intervened at a growing age, probably 8 to 10 years of age is something wherein we have to visit a dentist to take the required opinion.
Okay. And as a specialist, how do you decide that a particular 6-7 years old child, the treatment should be started right now, or it may be later? So what are the parameters for that in orthodontics?
Okay, so as far as every child has a growth phase. We have all heard about puberty. Okay, there is a growth phase. There are 3 kinds of growth spurts which are normally present. So you can take the required amount of radiographs or x-rays in order to determine whether the child is still growing, whether he or she is in peak growth spurt or not. If the child is in peak growth spurt, then you can take advantage of that growth, and you can modify the growth if the child is in that peak growth spurt. So this is using x-rays. You can take a profile view x-ray of the face in order to find out whether the growth is accelerated or not. You can take a hand wrist radiograph. You can take a small x-ray of the finger. Just one index finger can be can be used to determine whether the child is still growing or not. So there are various parameters. Sometimes the parents do not want to undergo any kind of x-ray radiation. They want to avoid radiation from the child. So in that kind of a scenario, the growth of the teeth or the presence or absence of the teeth is also an indicator whether the child is still growing or not. So all these parameters which are clinical parameters, so you can either use x-rays as a parameter, you can also use the clinical examination as a parameter to determine whether it is the right time to start the treatment or not, because these are all growth indicators.
Okay. So, Doc, in your view, we normally, I don't think so that many of the people know the difference between an orthodontic or a dentist. To be very honest, I mean, it's a very technical term for many of the audience, the people out there. So, when we visit to a normal dentist, what do you suggest to a dentist that when they should send the patient to a orthodontics? Like, what are the parameters there that when you go to a dentist, and when a dentist should refer you to orthodontic?
Okay, so I would normally advise every parent to take their child to a dentist, and as far as at the age of 7 years, minimum at the age of 7 years, and a dentist can look into facial or skeletal anomalies.
Okay.
Facial or skeletal anomalies in the sense, in case the chin is not growing, in case the chin is showing excessive growth,
Okay.
in case the upper jaw is showing undergrowth, in case the upper jaw is showing excessive growth, or there is slight amount of deviation in the overall facial structure, they should refer the child to an orthodontist who's the required doctor to carry out the corrections. So every dentist should look at facial structure in person As a dentist, normally people tend to just check whether the child has got a cavity or not, which is not the scenario as far as orthodontic consultation is concerned. Every doctor should figure out whether the child is showing any kind of deviation which is abnormal. Even the slightest deviation from the normal should be referred to an orthodontist, because this can prevent bigger surgeries
Bigger surgery, yeah,
at the
and
age of
lot of
18.
hassles.
Yeah, a lot of hassles for the parents. And the parents will also feel good that there is some amount of whatever the problem was, that has been addressed properly by my dentist by referring to an orthodontist.
Okay. So great. It was really very, knowledgeable session today. Rather than to, the people who wants to be orthodontics or a dentist, but for the general public also. Thank you, sir. Thank you
Thank you
so
so
much
much, Anu. Thank you
for
so much.
dropping, and we look forward more of your time.
It's
Thank
my
you so
pleasure.
much. थैंक यू सो मच गाइज. आई होप आप लोगों को इस एपिसोड से कुछ ना कुछ समझ आया होगा. So please suggest us that what you want to hear next. Thank you so much. Do watch the videos and subscribe the channel. Thank you so much.